Welcome to the Medical Home webinar series. This is the fifth in the Medical Home webinar series. Today's webinar will be presented by Malia, Corde, a parent advocate and former director of the Medical Home Initiatives at the Statewide Parent Advocacy Network, New Jersey, and Shama, a practicing genetic counselor at Robert Wood Johnson Foundation, New Jersey. Before we begin, a few announcements. This webinar series is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services under Genetic Services Project Grant to Health Research, Inc., NIMAC. This activity has been approved for AMA PRA Category 1 credits. There is reciprocity credit for allied health professionals, including nurses, physician assistants, and nurse practitioners. The required CME accreditation is included in the slides and handouts. Instructions on how to obtain a CME certificate of credit is also included in the attached handout. These three handouts, along with the slides, can be accessed through the control panel on your screen. If you do not find them or find it difficult to download, please send an email and we will make sure to follow up with you. This live webinar will take approximately 1 hour and will be recorded. The recording will be available at a later date. As soon as the webinar concludes, you will be asked to complete an evaluation survey. Please take a few minutes to provide your feedback. Your input will help us in planning future activities. Participants claiming CME credits, please use how to obtain CME credits instructions handout to complete your evaluation and claim the CME credit. All other participants, please complete the evaluation survey that follows after the webinar. There are no conflict of interest disclosures or off-label discussion to announce. At this point, we would like to acknowledge our colleagues. We thank HRSA for their support. We thank all speakers and participants of this Medical Home webinar series for their contribution and participation in this series. Should you choose to ask questions or comment, please use the question box in the webinar tool panel to submit your questions and or comments. Please note that all participants are in listen-only mode, so we request you to type your questions and comments in the question box. We will cover as many questions as time permits, and responses to the remaining ones will be emailed later. For the purposes of this webinar, we encourage you to think about what real-life resources and experiences have been helpful in your practice or your experience. Please feel free to share those resources so we can compile them and send it to all attendees together. On that note, we are pleased to invite Malia, Corde, and Shama to present today's webinar. Thank you for joining, everyone. Thanks, Malia.
Good afternoon. So I'd like to address the two objectives that we have for this webinar. List user-friendly and meaningful resources on medical home and care coordination, and discuss applicability and relevance of different resources on medical home. Next slide, please. So we'd like to just take a poll at this time to ask you if you have used medical home resources previously. If you could please select either yes or no.
We are about 75% voted, so would you like me to close the poll, Malia?
Sure. Okay, so we have about 60% showing that they have used some type of resource for medical home and care coordination, so that's great. And we have about 40% that have not. So hopefully today you'll learn about some new resources that are available both for providers and families who have children and young adults with a genetic disorder or a special health care need. Next slide. Okay, so now I'm going to share a little bit about an experience that my husband and I had with our now young adult son, who is 24. Kyle was born about 24 years ago with spina bifida, and as many families, once he entered public school, our focus was on making sure that his education was appropriate, that he was getting all of the supports and services that he needed in regards to education. And we didn't think too much about the health issues that he had to deal with on a daily basis, and the fact that he had had multiple hospitalizations through the years. And as he got older, we realized that his health was having a large impact on his education and his ability to keep up. And so we knew that we needed to focus more on that piece of his life and making sure that his health needs were being addressed, not just in school, but also at home, in the community, and wherever Kyle was having activities. We wanted to make sure that he was feeling comfortable, he was feeling safe, and he was getting the health care that he needed. And so I just want to emphasize, both for the providers and families that are on the phone, that we really need to look at the whole child. And that means what the child or young adult is doing throughout the course of that day, whether they are in a school program, whether they are at college, or whether they are, employed or at a vocational setting. We want to make sure that those healthcare needs are addressed, especially planning ahead for trips that you may be going on for vacation or out of state or even out of the country, making sure that you have contact information for your healthcare providers, making sure that you have the most recent tests, blood work, MRIs, any kind of health-related information that you may need to share with a healthcare provider that does not have your child's history. Care plans, making sure that your child's care plan also includes an emergency plan. What happens if mom and dad are not available? What happens if there's an emergency? What hospital do they go to? What are the next steps? What are the priorities? And documentation, always keeping an updated version. We have a individualized healthcare plan that we use for Kyle to ensure that the most updated information is made available. And then wherever we go, whatever we do, we have that information with us. And following up, if the child or young adult needs to go into the hospital or has some testing done, that information is updated and provided to that child's medical home, their primary care provider, and specialists as appropriate. We know that many young children and young adults with a genetic disorder or special healthcare needs also have multiple specialists. So it's very important to ensure that all of those healthcare providers have the updated plan. So making sure that your child is well cared for and that the plan meets the needs for that child and what their specific diagnosis or what their specific healthcare needs call for. Next slide. So as Kyle transitioned from pediatric care to adult care, we were really looking for somebody that had comprehensive care. And so it didn't happen overnight. It took, a couple of weeks of consultation and communication back and forth between the pediatric and the adult provider. to ensure that the seamless transition would happen and that everybody was informed and communicated and had the correct information to make that transfer. So when we talk about medical home, we're really looking at many different components. It's not one type of service. It's not, a particular type of setting, but really it's about the way services are delivered, accessible, that there are weekends and evening hours, that there's physical, ADA compliant accessibility for those people who may use a wheelchair or some other type of durable medical equipment, that it's family-centered, focused on the child and the family's needs, continuous, so that there is no gap in service, that it's continuous through transition or transition to adulthood or transition out of a hospital back into maybe the public school system. Comprehensive, that it includes all of the services and supports that a child may need, not just the medical, but also the social, the emotional, all of the, community supports and services as well. And we'll talk a little bit more about that later. That it's coordinated, so that there is somebody coordinating all of those services and supports. And typically within the medical home, that would be the primary care provider. That the services are compassionate, that the doctor and practice staff understand the needs of the child and family, that they're addressing the culture and the religious aspects of the child and family's life and how that plays into the way that their healthcare services are being delivered. The National Center on Medical Home Implementation is a great resource for information about medical homes, so that's a good resource to look to find other tools and other information. Why is medical important, especially for children and young adults with genetic conditions? Because it provides optimal outcomes for children and youth. And it also requires families to access services across multiple systems, which often can be very challenging and stressful. And so if there is a medical home for that child, it's going to be better coordinated, it's going to be integrated and more seamless and more accessible and more family friendly. And in the outcome, will provide better services and health outcomes for that child and family. Next slide, please. So families involved in decision making are more satisfied with the primary care provider and the services their child receives. Families active in developing a care plan for their child are also more likely to follow and maintain that care plan. Sometimes we hear from families that the plan doesn't really meet the family's needs because often they're sitting in a room with the doctor or practice staff writing up the care plan, and then when they go home, real life happens. And so we really want to let families know that the care plan is a work in progress, and so they need to communicate back to the healthcare provider if something's not working. That care plan should be addressed and updated and changed accordingly. And so that's an important piece to remember, that once the care plan is written, it's not set in stone. It's important to address anything that may come up once that has been done. Also making sure that children are not receiving multiple tests for the same thing from different doctors. So there's, not a need for a consistent or multiple testing, is really to cut down on things like that. Providers often feel better and more confident about caring for their children and youth with special health care needs because they know about what resources are available, and they're able to care for their child, the whole child, and not just their health care needs, but be more involved in the educational needs, the social and emotional needs of that child, which in the end, when you're looking at all of those pieces together within the medical home, are going to improve outcomes for that child and family. Next slide, please. So We also know that many children with genetic disorders have multiple specialists involved. And so once again, it speaks to letting families know that if your child needs a specialist, that a pediatric specialist is different from an adult specialist. And so sometimes families may have difficulty trying to identify pediatric providers. So trying to help them, understand how their insurance works, whether it's private or public, is often, a good resource to share with them and to, make sure that they're aware of that. Crossing state lines, many families have to deal with multiple hospital systems or multiple healthcare providers that may not accept their insurance. And so it's really important for families to do that, that research ahead of time so that they're aware of what the cost would be, or to ask their healthcare provider to help them identify pediatric providers. They could also call their health insurance carrier to let them know that they're having trouble trying to identify a provider. And also care coordination, very important. Often we hear care coordination and medical home interchangeably when we talk about medical home, because many children and youth with special health care needs do need care coordination. And often there are multiple people involved in coordinating that child's care. Sometimes there's care coordinators through the private practice or federally qualified health center where the child's medical home is. Sometimes they have a care coordination person through the insurance carrier, or even here in New Jersey, we have Special Child Health Services case management units that do some kind of case management. And so there's a lot of people coordinating that service and support for the child. And so having a medical home, having somebody that can kind of oversee all of that really cuts down on the stress and the, anxiety that sometimes families feel trying to do that on their own. There's also something called co-management agreements, and the link here, medicalhomes.aap.org, has some tools which are really helpful to help with that care coordination among specialists and to help with the communication between providers that are working with an individual patient. Next slide, please. So at the Statewide Parent Advocacy Network in New Jersey, we've had multiple medical home initiatives over the years. We started many years ago with our state implementation grants for children and youth with special health care needs, and then our second one was focused on children with autism, and the third was focused on federally qualified health centers working with underserved and immigrant families. With many of our projects, we have partnered with the New Jersey Department of Health, AAP New Jersey, and also the New Jersey Primary Care Association. Most recently, the New Jersey Department of Health has received another state implementation grant, the D70 grant, and so we are partnering with them again. So it's been really great to see the growth of the practices here in New Jersey. We have been working with the practices, providing learning sessions, face-to-face sessions, as well as webinars to access information and resources for families. We also have been working with our University Center for Excellence on Developmental Disabilities in regards to parent-led developmental screenings and resources for families for federally qualified health centers, as well as early Head Start and Head Start programs. And most recently, we have been working with Children's Specialized Hospital and Hackensack Medical Center on their autism medical home grants. Next slide, please. So here are some other resources that we have shared with our medical home practices that we have worked with. There are a lot of resources out there, and one of the things that the practices themselves shared with us early on was that they need resources, but they need them to be organized and accessible, not just for families, but for themselves, so that they know where to go and how to get the resources in a timely manner so that they can share it with the families that they care for. And so we provided for all of our practices a resource binder, and each resource was placed in a plastic liner. It was organized by topic, and there was a table of contents. So it was very accessible. They could take the resource out, make a copy of it for the family, and then stick it back in. And so everybody in the practice knew where the binder was and was able to access those resources. And so a couple of the things that we have here is our GPS for families of people with special healthcare needs. That's a very comprehensive guide. It's about 80 pages long. Our Family Voices coordinator, Lauren Agaradas, created it, and it is basically A to Z, everything you could ever need as far as resources. So that's really an awesome resource for families. Our Health Advocacy Toolkit has a lot of health-related fact sheets, especially in regards to healthcare financing. And then also we have the NIMAC and SPAN Medical Home Toolkit that was created out of the medical home training that we did, I think it was 2 years ago here in New Jersey, where we brought different states in from the NIMAC region to do a one-day comprehensive medical home training, and created a toolkit out of some of the resources that we had here in New Jersey and the other states shared with us. And then lastly, our transition resources for healthcare practitioners. This is, once again, really great one-page fact sheets that providers can use and make copies of to share with families. Next slide, please. So some of the things I just wanted to share that the providers that we worked with said about medical home and how it had an impact on their practice and the families that they cared for. Excuse me. They learned about new resources and services to share with families. So I think that's most important. Many of the practices shared that they didn't have the time or the staff to identify those resources themselves. So as families, we know what works, what other families have shared with us, and so it was made sense for us to kind of share what we learned and from ourselves and from other families. It also improved family and professional partnerships. It improved the communication that they had with their patients. They felt more confident about caring for those patients, and you know, it made them really understand what families go through on a day-to-day basis raising a child with a genetic disorder. And also, it helped them align with being able to apply for NCQA, or the Patient-Centered Medical Home Recognition. A lot of the work that we asked of them as far as our evaluation did align them with being able to apply for this recognition, so it was helpful for them. And it also set them up for doing more quality improvement work on other projects, you know, in regards to working with the AAP here in New Jersey. Next slide, please. And medical home, we're not talking about big drastic changes that could really have, you know, a significant impact on a practice, but really little changes that have big impact. It doesn't have to be a big impact to have or a big change to have an impact on a family. It's the little things sometimes that really go a long way when families see that their healthcare provider are really trying to, you know, be a better medical home. So these are some of the quotes that we received from families in regards to their participation. We had trained our parent partners within each of the practices to work as part of that medical home team. so that the families themselves could, you know, give some information and feedback about some of the changes that were happening, and what that would mean for the families in that particular practice. And so, you know, the last bullet here, they wanted my feedback and perspective. It made me feel important that they reached out to me to assist them. After working with them, it was great to see that the practice really wanted to improve for all families. And so again, just opening up that conversation and communication between families and providers was very helpful to everybody that was involved in the different initiatives that we had. Next slide, please. And the providers also were really excited about having the parent partners participate and, you know, share their experiences. Also, the second bullet here, you know, talked about the parent being able to share their experience with other parents in the practice. One of the things we often hear still is that parents were not kind of connected to other parents that have similar children with similar needs. And so for us as families, that's a big thing that we try to share with doctors, that if you can connect your patient with one other family that is going through a similar journey, could have very profound impact on that family, on their ability to cope and to find hope in their child's future. And so there are several resources that we'll talk about a little later about how we can connect families in that way. Next slide, please. And so once again, going to the parent-provider partnership, it facilitates open communication so families and professionals feel free to express themselves. It creates an atmosphere in which the cultural traditions, values, and diversity of the families are acknowledged and honored. It recognizes that negotiation is essential, that families and providers may always not agree on everything, but that if you're open and honest and you know, share your feelings, it makes that communication and those decisions much easier in the end. It also acknowledges mutual respect for each other's cultures, values, and traditions. Families and health professionals work together in the best interest of the child, and as the child grows, he or she should become part of that team, as part of that partnership. Everyone respects the skills and expertise brought to the relationship by each partner. The families know the child best, but the healthcare providers have that expertise that we as families look for and appreciate. Trust is acknowledged as fundamental. Communication and information sharing are open and objective. Participants make decisions together, and there's a willingness to negotiate. So now I'd like to introduce Shama, who will talk a little bit about the resources that she has identified for the patients that she works with in her office.
Thank you, Malia. Good afternoon. As Kunal mentioned earlier, I am a perinatal genetic counselor and also a research coordinator in the Division of Maternal Fetal Medicine at Robert Wood Johnson Medical School at Rutgers. My interest in medical home initiatives and participation in this webinar stems from my clinical experiences and motivations to advocate for not only my patients, but the entire family. Next slide, please. And I'd like to share with you some case examples from my clinical experience. I'd like to say that all identifiers have been changed. These examples are based on my experiences, but details have been changed to protect the privacy of the patient. The examples that I'll be using today are Duchenne muscular dystrophy, Down syndrome, phenylketonuria, and 1p36 deletion syndrome. And I'll be discussing some relevant resources and support groups, such as national organizations, online networks, and advocacy groups. Next slide, please. So the first clinical example is of Duchenne muscular dystrophy. Jacob was recently diagnosed with DMD and presents for his initial visit with Dr. Rivers. The genetic counselor, Carolina, takes his medical and family history and finds out that he has a sister who has been complaining about muscle weakness. Being that this is a new diagnosis, Jacob and his family have limited information, such as the inheritance pattern of DMD. They were not expecting to learn that his sister may possibly be manifesting symptoms of a carrier. What support resources are available, specifically for families coping with the new diagnosis that affects multiple family members? Next slide, please. So the Muscular Dystrophy Association is a great resource. Families are at the heart of their mission, which is to create more hope and answers for families living with muscular dystrophy and related diseases that take away physical strength and mobility. I actually wanted to share a quote from a family of just how great this resource is. They said that within 24 hours of our son being diagnosed, we had contacted the Muscular Dystrophy Association, and that was a fantastic move to make. We learned throughout that there was hope. Another interesting resource is the Horse Ability Center for Equine Facilitated Programs. Research has shown that therapeutic riding students can experience physical, emotional, and mental rewards. And for individuals with impaired mobility and issues such as muscle weakness and Duchenne's muscular dystrophy, it is really beneficial, not just for the physical aspects, but the psychological, physical, and social parts too. Next slide, please. And the next example is of a patient with Down syndrome. So Jenny and her mother present to clinic with Jenny's 1-month-old baby, Allison, to receive the genetic testing results confirming Allison's diagnosis of trisomy 21. Jenny had a first trimester screen that indicated an increased risk for fetal Down syndrome, but declined invasive testing to provide diagnostic information. At that time, she had accepted the possibility of having a child with Down syndrome, but didn't concern herself with preparing to raise a special needs child, especially as a single parent. After receiving the news, she immediately becomes withdrawn. Next slide, please. How might the provider approach this patient regarding resources that she would be receptive to given her current situation and state of mind? I think as a provider, this is something we commonly experience, and sometimes our instinct is to just provide a resource such as an in-person support group or give brochures or information right away. But we need to be mindful about each patient is unique, and that might not be appropriate for the person who's right in front of you. So one option is to provide the availability of online support groups, which may be less intimidating than in-person meetings. Like I mentioned, connecting patients with other families is a wonderful resource, but it may be more appropriate to start off initially with the forum that provides the patient with more anonymity. Another thing to consider is sending brochures in the mail rather than overwhelm the patient and allow her time to process the news. So in this particular case, along with the brochures, contact information for the genetic counselor and physician was sent, which encouraged the patient to schedule a follow-up appointment when she was ready to share her thoughts and concerns. Next slide, please. So as a perinatal genetic counselor, this is one of the narratives that we share with some of our patients, and I really wanted to take the time to read this. Longtime Sesame Street writer Emily Pearl Kinsley has been advocating for people with disabilities since 1974, when her son Jason was born with Down syndrome. And in 1987, she wrote Welcome to Holland, which has remained a source of comfort and inspiration ever since. I am often asked to describe the experience of raising a child with a disability, to try to help people who have not shared that unique experience to understand it, to imagine how it would feel. It's like this. When you're going to have a baby, it's like planning a fabulous vacation trip to Italy. You buy a bunch of guidebooks and make your wonderful plans. The Colosseum, the Michelangelo David, the gondolas in Venice. You may learn some handy phrases in Italian. It's all very exciting. After months of eager anticipation, the day finally arrives. You pack your bags and off you go. Several hours later, the plane lands. The stewardess comes in and says, "Welcome to Holland." "Holland, you say? What do you mean, Holland? I signed up for Italy. I'm supposed to be in Italy. All my life, I've dreamed of going to Italy." But there's been a change in the flight plan. They've landed in Holland, and there you must stay. Next slide, please. The important thing is that they haven't taken you to a horrible, disgusting, filthy place, full of pestilence, famine, and disease. It's just a different place. So you must go out and buy new guidebooks, and you must learn a whole new language, and you will meet a whole new group of people you would never have met. It's just a different place. It's slower paced than Italy, less flashy than Italy, but after you've been there for a while and you catch your breath, you look around, and you begin to notice that Holland has windmills, and Holland has tulips. Holland even has Rembrandts. But everyone you know is busy coming and going from Italy, and they're all bragging about what a wonderful time they had there. And for the rest of your life, you will say, "Yes, that's where I was supposed to go. That's what I had planned." And the pain of that will never, ever, ever, ever go away, because the loss of that dream is a very, very significant loss. But if you spend your life mourning the fact that you didn't get to Italy, you may never be free to enjoy the very special, the very lovely things about Holland. Next slide, please. So the National Down Syndrome Society is the first resource that we give to our patients who have a child with Down syndrome. It's an excellent resource. Researchers say that what seems to determine if families are resilient and able to thrive is their ability to access individual, family, and community resources. And the mission of the National Down Syndrome Society is to be the national advocate for the value, acceptance, and exclusion of people with Down syndrome. They have a very family-friendly website, especially the link that I put below the main website about local support. It actually pulls up a map and shows that there are more than 375 local affiliates that provide an array of benefits to help better service the Down syndrome community. And these include new parent support and education, family meetings, sibling and grandparent support, recreational activities, lending libraries, helplines, regional conferences, and other partnerships. So it's really a wonderful resource. Next slide, please. The third example, the previous slide. Okay, thank you. The third example we're going to talk about is newborn screening. So Samantha is 6 months old and diagnosed with PKU on newborn screening. She has 5 brothers and sisters. Given that PKU is a metabolic condition that requires strict dietary control, what are some resources that providers can suggest to help families deal with the lifestyle changes that may affect the daily routine of the entire household? So in addition to educational materials for families, it's important that they have material that they can disseminate at school to educate not only the teachers about what the children can eat, but also their classmates as well, because it's so common to share snacks at school. Also, support groups for patients to meet other kids that struggle with the same dietary restrictions is also important. Next slide, please. So the National PKU Alliance is a great resource. They have multiple different resources. I just took out 2 that I thought were notable. They have PKU camps, so each year a number of state organizations and clinics host camps for children and families with PKU. Also, a mentor program. They considered connections as critical to the PKU community. And they have a teen and adult program that hopes to have many projects that connect teens and adults to one another. Mentoring is a brain to pick, an ear to listen, and a push in the right direction. And I thought that they do a great job of showing options that are available for the entire family and not just for a child that was diagnosed with PK. Next slide, please. So the last example I'm going to talk to you about involves rare genetic disorders, which we are increasingly seeing in our field with the new technology that's being available, allowing us to detect more and more changes. After a long and exhaustive diagnostic odyssey, Mark and Katie finally received a diagnosis of 1p336 deletion syndrome for their 5-year-old daughter. After receiving the phone call from the genetic counselor to schedule an appointment with the medical geneticist to discuss this condition, they immediately went to the internet to do some research. Upon going online, they were disheartened by the limited information that they were able to find about this rare chromosomal disorder. What are some resources that are available to share with patients regarding some of the less prevalent genetic conditions that we're now able to detect? Next slide, please. So this organization, Unique, is it's amazing. The membership of Unique is free for families and individuals affected by rare chromosome disorders. They have so much literature, which is an amazing tool for us because it's so difficult for even us as providers to find information that's not only thorough, but family-friendly and able to be relevant to our patients, because genetic information in general is complicated. To have to explain something so complicated in simple terms can be challenging, and this organization really has done a wonderful job at providing family-friendly resources. Their mission is to inform, support, and alleviate the isolation of anyone affected by a rare chromosome disorder and to raise public awareness. They are an international group. They publish a magazine 3 times each year to promote awareness of rare chromosome disorders. They link families whose children have similar chromosomal disorders. They really do a lot to support and promote relevant research projects and help families participate in relevant research projects as well. Next slide, please. Okay. So I'm very happy to share the resources with you that I've identified as a provider, and now Malia will add some additional resources that she has identified from this project and from the perspective of the family member.
Thank you, Shama. And as Shama mentioned, there are many types of families, and so there's no one resource that's going to work for everyone. And so just understanding that, you know, each member of the family has different needs, whether it's siblings, parents, the child or young adult with the genetic disorder themselves, or, you know, grandparents. There is a wealth of information and resources available. And so today we just wanted to kind of share some of those resources with you, and understanding that the way these resources can be made available have really grown through the use of technology, whether, you know, the family or individual wants to be part of a face-to-face support group, online support groups, or such programs like parent-to-parent that provide individual one-to-one support via the telephone. Shama also mentioned, you know, that anonymity, especially at the beginning of a family's journey, it can be very hard for families to reach out when they're just coming to terms with their child's disability or diagnosis. Next slide, please. So some of the reasons why it's important for healthcare providers to know about what those resources are is so that they can also share with their practice staff what the resources are, especially that front end staff who answer the telephone or at the desk when families come into a waiting room. That's the first contact that a family will have with that practice or that healthcare provider office. And so you want to make sure it's a positive one. So if they are looking for resources or do have questions, that anybody in that office will be able to know where to go or how to obtain that information for a family. It's a critical resource, and it's, again, speaks to the partnership, the collaboration, and the interest of, wanting to work with families and improve outcomes for children. You could also, as a provider, invite some of the community partners into your office and, invite families in one weekend or evening to talk with the community partners in more detail to hear about the different resources and information they have. Hanging a community bulletin board in your waiting area to post some different activities that are going on, workshops, conferences, things that might be beneficial to some of the families or even your staff. And just, again, connecting those families, your patients, with other families that have had similar experiences goes a long way to really improving the stability and the ability for families to parent their child. Next slide, please. So I'm going to run through these pretty quickly. We do have quite a few resources, but as Kunal mentioned earlier, the slides will be shared with everyone, and so then you will have all of these resources. Family history obviously is really important, especially for children and young adults that have a genetic disorder, to really understand the importance of knowing their full history. Often we talk with families and young adults when we do focus groups, and they may know mom's side or dad's side or neither side. And so as children get older, as they transition, as they become young adults, again, ensuring that they are taking ownership of their own health and their health needs, it's important for them to have an understanding of what their health history, what their family history is about. Next slide. So here are some great tools in regards to putting your family history together and having those tools to be able to share with your healthcare provider. Once again, is really critical in knowing what your risks may be for some diseases, and then reducing your own personal risk in regards to specific diseases. And also just being able to look for early warning signs of disease as that individual child or young adult gets older. Next slide. So some other resources that really are very helpful for families and that will be able to connect them to other families with similar experiences is the Caregiver Action Network. We know parents often can be stressed or feel overwhelmed by some of the care or things that they need to do on a daily basis for their child. So being able to find some ways to relieve some of that stress or to share those experiences with other families is very helpful. Family Voices is a national organization that promotes quality health care for children. The Genetic Alliance is one of the world's leading nonprofit health advocacy organizations, and so they engage individuals and communities to transform health and to talk about health issues. NIMAC is the New York Mid-Atlantic Consortium for Genetic and Newborn Screening Services, which does a lot around medical home and care coordination, and is just a great resource for families with genetic disorders. And Parent to Parent USA is a national entity that provides technical assistance and support to statewide and smaller parent-to-parent programs. If you go to parenttoparentusa.org, there's a map, and so you can click on the state and find the local parent-to-parent program within that specific state. Next slide, please. So the The ARC for people with intellectual and developmental disabilities has a lot of great information and resources archived on their website so that people can go on and listen to the audio recordings. The support organization for trisomy 1813 and related disorders, and also a heartbreaking choice. Next slide, please. In regards to transition to adulthood, transition can also be one of those trying and stressful times for both families as well as the young adults themselves. And so I really wanted to make sure that we had some good resources to share with you. Supported decision-making is becoming more and more popular, which is really great to see. Having the young adult participate and be part of that decision-making process is often difficult for families and healthcare providers, but it's very empowering and great to see young adults being engaged and having the opportunity to participate in their own healthcare. So there's some great resources around the supported decision-making process. Also, in regards to guardianship, that there are alternatives for guardianship. So we, think it's important to let families know that it's a personal decision and that they really should research exactly what options are available and what would be most appropriate for their son or daughter. There's also a health advocacy toolkit by the Autistic Self-Advocacy Network, which you can access on our SPAN website, which is spanadvocacy.org, and then you just click on resources. We also have 2 archived webinars. One is on the supported decision making, and the other one I have listed here is being a healthy adult, advocating for your health and your health care. Next slide. Insurance coverage is also, a big issue for families. Many families have health insurance, but it may not be appropriate coverage. And so really looking at what are those gaps in the coverage that their insurance has. We always tell families you must read your handbook to really understand what your insurance covers and what it doesn't. And that's both, for public and private. Here in New Jersey, we have Medicaid. We have 4 or 5 Medicaid providers who are really trying to identify what provider would fit best for your child's healthcare needs, what are the services and supports that they need, and try to match that the best that you can, and identifying what those local resources are. And Family Voices has some great resources and information about that. So, another good place to look for information when it comes to insurance. Next slide, please. And here are some resources focusing on medical home and the Patient-Centered Medical Home Resource Center. For families that are looking for a medical home for their child, if they're not sure if their practice or healthcare provider is a medical home, certainly ask. You could also call your local AAP chapter and ask them if they could identify, practices within your state that are deemed a medical home. Also on the AAP website, there is a map that lists medical home initiatives as well as medical home resources within each state. So there are ways for families to identify where medical homes are located in their state. So also we want to make sure that we ask the participants on the line today if there are resources that you know about that have not been mentioned today, that it would be great for you to share those with us and the other people on the phone. Next slide. So here are some more medical home resources, and next slide. Care coordination resources, the coordinating care for children with genetic disorders. This document has just recently been completed. It's a comprehensive document and a wealth of information and resources, for everybody to look at. The slides coming up after these are resources that have been shared on our previous webinars as part of this medical home webinar series. And so I really don't want to go into each and every one of those, but just to let you know that they are here as part of this. And we'd like to open it up now for some questions or thoughts or comments from the participants on the phone.
Thanks, Malia and Shama. We did have a very early comment or question that says, the binder that we mentioned that we're going to compile, is it going to be available online to use as a guide for others, which may include local or national resources? So as you rightly pointed out in this presentation, that it's beyond the scope of this 1-hour webinar to include all resources. So we welcome additional input and sharing of resources from the participants of this webinar so that we can compile those resources for everyone. There is a comment that says we recently updated the NJ Mental Health Guide to a national version, and the link has been shared, so thank you for sharing that with us. And we did receive a few other resources as well. So we do have a couple minutes. If you have any questions for our speakers, please type in your comments. In the meantime, I'm going to run through the resource slides from the previous webinars. So here are some discussion questions for consideration. It's a long way forward to accomplish 100% satisfaction with utilization of all resources. So we do appreciate your comments and thoughts on this particular questions as well. While we wait for the comment question, I wanted to ask our speakers if they had any comments on the first question. What could be the future of medical home care for genetic disorders, and obviously, if you could comment on how can we contribute towards that.
Yes, Takal, I'm happy to comment on that as a provider. I think having like a toolkit and just compiling resources together and having us as providers kind of share that these resources exist with our colleagues would definitely be something that would be very helpful, because I think a lot of times providers aren't aware that not only do these resources exist, but where to able to access them. And I think it's important that as colleagues, we all work together to share this information.
Yeah, and Kunal, I think it's great that we have technology. It has made resources more accessible, both for families and providers. We know back in the day when we had hard copy, as soon as it was printed and disseminated, things were already changing. So with, having websites and having that technology available, resources can be updated more often, which makes it more accessible for families and providers. So I see more of that happening. I know NIMAC is continuing to update their website and make it, more accessible and more family friendly, and to include more and more resources. Because I think part of the, interest of having more resources is trying to understand how they work and, what types of resources are available. That in itself can be kind of overwhelming when you're trying to work with a family and trying to point them in a specific direction. So, just organizing them and having them accessible, I think, has really helped families be able to connect in a more timely manner.
Sounds great. Thanks for that insight. We did have a comment, and I want to read it out because I think it's extremely important. And I want to thank the attendee for making that comment. Is don't forget our military families. And the attendee had presented to the statewide group on SHC transition for educators and shared the resource as well. Many thanks for sharing that with us. Considering the timeline, we would like to conclude this webinar series with a couple notes. And as promised earlier, we are going to compile the comments and questions and get feedback and responses from our speakers to share with all attendees. So these are the speakers' information if you would like to reach out to them directly. And just as a concluding note, a quick reminder for completing the evaluation questions. And should you have any questions about the webinar series, resources, or need additional information, feel free to reach out to us. Once again, the slides from today's webinar are accessible through your control panel, and they are available for download. It also includes a handout on how to obtain CME credits so please refer to that for accessing your or claiming your CME credit. On that note, I would like to thank our speakers for today's webinar and all our attendees for your time. Thank you, everybody.